Thank you very much, Esther, for inviting me to give a talk about what I do, and thank you, NATMA, for the invitation as well. Like Esther said, I work in Buffalo Grove in a great practice with two other pediatric dentists, Fred Margolis and Anjali Talati. We also have an orthodontist that works with us as well to kind of give us a little more comprehensive needs that our patients and parents desire. So given this broad range of audience members that I see a little infant, and I see people my dad's age, which I think in that broad spectrum, I hope everybody gets to take something from this. I will focus primarily on the pediatric patient from birth all the way up to 18 years old, but I have inserted some information that I think all of us can benefit from. So I'm going to talk about basically two things. One is your cavity and how to prevent it. You need, like a cookbook, you need 3 ingredients for a cavity. Most all of us are going to know this recipe, but I'm going to actually tell you a little more about something you may want to know and how to prevent it. So you need bacteria, a certain type of bacteria. It's not all bacteria that makes a cavity, but you also need the carbohydrate. It's listed as a sugar, but we oftentimes want to stress to the parent that it's not just the sugars that you find in candy bars or in ice cream that are going to cause your child a cavity. It's any complex carbohydrate, where it's bread, rice. It's what the bacteria changes it into, and that is a simple sugar. So that's the second ingredient for the recipe. And the third is having a tooth, of course. I know some of you guys don't know this, but this is an interesting factoid. Within a minute and a half after eating a carbohydrate or a sugary substance, you're going to start getting some acid production, and that's what starts dissolving your tooth. So in this cartoon, assuming it takes 20 minutes for an average meal and a few snacks, you can get up to 2 hours of acid attack on your teeth. And it sounds like a long time, and it is. So the progression of tooth decay, we all know pretty much. It gets bigger. As a pediatric dentist, my most common question I encounter during the day is, well, if Johnny has a cavity, why are we going to fix it? The tooth is going to fall out. Well, that may be true, but if Johnny is going to have that tooth in his mouth for a couple more years, sometimes even 5 more years, that cavity will get bigger, and little Johnny will be coming to my office with a toothache and an abscess, and we're going to have more problems than just the pill. So another interesting factoid, this is probably increased now, but it says behind me that the average person consumes 125 pounds of sugar, and that's going to be probably more nowadays since I made this slide presentation. So it keeps us pretty busy. And another interesting factoid is, like, all of us in the room, if there were 100 of us in the room, there may be two people in the audience who, whatever they do to their teeth, and if they never go to the dentist and they just abuse their teeth, they're not going to get a cavity. There's 2% of the population that won't ever have a problem. So that is the rest of us. 98% really need to see the dentist. The prevalence of tooth decay compared to some common child ailments such as the asthma and the hay fever really represents itself as a very, very big problem. So I'm going to now transition this to dental care, since I made you guys all experts on cavities. As a pediatric dentist, we do recommend that the first visit by the child and the parent commence at the age of 1 or when the first tooth comes in the mouth. The American Academy of Pediatric Dentistry recommends that because we are trying to prevent most of the oral health issues to the child by educating the mother or the father basis for prevention and oral habits, oral hygiene, diet, and the appropriate administration of fluoride, which I will talk about in a minute. So some of these pictures are from some of our patients, and toothbrushing is the first thing that comes to most of our minds in terms of preventing tooth decay, isn't it? Well, it's not always that easy as this slide says. From the beginning, I saw a little cute baby over there. Essentially, cleaning off milk or formula residue is a good start. And using something such as this, it looks like a little sock, but the easiest thing of using is a clean washcloth with plain water. It gets your child used to doing that. It does remove the residue that sometimes starts making an odor on it. And this is one of the very first things you can do for the young patient and his young child. In our office, we do begin by, of course, teaching the basics of oral hygiene, toothbrushing and flossing, and proper diet and eating. But in the latest 10 years, the advent of the electric toothbrush has really improved everybody's oral hygiene. Now, there are so many different types, and I do get different questions of which brand I recommend. And in this audience, I'm sure at least half of us own an electric toothbrush. But in this study, this is the reason why dental professionals such as myself recommend the use of an electric toothbrush versus the regular. The first two on the left is a combined score of 80% of dental professionals feel that there is either considerable improvement or somewhat improvement in their patient who's using the electric toothbrush versus 14% when there's apparently no change to the patient's oral hygiene. Another published clinical study here also compares the efficacy of an electric toothbrush versus a manual one. So it's oftentimes quoted as saying that it's 5 or 6 times more efficient to the user of an electric toothbrush than the regular toothbrush. This slide reminds me to caution, I guess, the audience of buying their grandchild or their young child an electric toothbrush if they're younger than 5 years old. Some of this fancy stuff that we can use on ourselves, we oftentimes do not want to start that on the child. Someone at this age, they make these special toothbrushes where they can grab the handle. We still don't recommend that they do it themselves, but this starts to teach them the dexterity, gives them the idea of the sensation in the mouth, and the main job should be still with the parent. Well, flossing is a different story, I think. I can jump a little bit, but that's okay. Flossing, of course, is harder for the general population to master and therefore to do. As of yet, there really hasn't been an automatic flosser that is proven to completely replace manual flossing, though some have come close. Flossing has been one of the single most important preventive things that somebody can do for themselves, but it's not performed, unfortunately. So another preventive subject matter is fluoride. Now, fluoride has been a subject of debate in the news several times, and oftentimes health professionals like yourselves and parents like yourselves just don't know when to recommend the start of using toothpaste on children and the types of toothpaste, which there are several. One thing with fluoride in the water source